Hey guys, Nicole Eddy here, graduate student from University of Maryland, and I'm back again with video 2 of our assignment, and this is pre-hospital tourniquet use. So the target audience, this includes not only EMTs and hospital providers, this also includes everyone, bystanders, police officers. Life-threatening bleeding can occur at any time, and it takes a person less than 5 minutes to die from bleeding out. No matter what, bystanders will be the first on the scene before emergency personnel. The objectives: at the end of the course, the students will identify signs of life-threatening bleeding, learn the proper use of a tourniquet, and demonstrate the appropriate application of a tourniquet to extremities. Why is a tourniquet necessary? Tourniquets are used for life-threatening hemorrhage from limbs that can't be controlled by simple methods or direct pressure. Tourniquets can be also used for limbs with multiple uncompressible bleeding points, and recent studies have associated tourniquet use with increased chances of survival. Pre-hospital use of tourniquets is strongly associated with life-saving. So first, how do you want to identify life-threatening bleeding? There are certain indications that bleeding can become life-threatening. First, you need to find the bleeding. You need to take off the clothing, look for the source. You need to uncover the injuries that you might not be able to see while he's dressed. And to look for life-threatening bleeding, look for pulsatile or steady bleeding, look for saturated clothes or bandages, look for pools of blood around the patient, and look to see if the patient is exhibiting signs of shock, including being confused, anxious, pale, cool, or clammy. We're going to watch a small video on life-saving tourniquet use.
Our message is to those people that work in industrial settings where they would be at risk of their limb being entrapped, farmers in an agricultural setting, and dialysis patients should all consider having ready access to a tourniquet. The first person we teach to put a tourniquet on is the individual putting it on themselves. And if you do not have that tourniquet on your person, then you may not be able to get to it. Certainly, this is a big push in law enforcement. All of the law enforcement officers should be being trained, should be personally wearing, is what I call it, wearing a tourniquet, much the same as you would wear a belt. What you have to have is a wound that will be amenable to the placement of a tourniquet. If the wound is too high up on the body, then there's no way to get the tourniquet between where the wound is and the heart, okay? So if the wound is here in the forearm, you can put a tourniquet on above that level or even higher up if you want to. And these tourniquets are manufactured specifically for hemorrhage control purposes, have been tested, and they are endorsed by the Committee on Tactical Combat Casualty Care. There are a lot of counterfeit tourniquets out there that don't really work very well at all. And we don't want to use those kinds of tourniquets in this situation. So what we'll do is we'll place this tourniquet around the limb, loosen up this Velcro strap here, tighten this down as best we can above the level of the wound, okay? Then we're going to secure this Velcro on here like so. And then, just like the old Boy Scout windlass and cravat, we're going to turn this windlass until the bleeding stops and we feel that there's no pulse distal to that tourniquet. And then we'll secure this in place, and then we'll monitor this wound to make sure that as the patient improves and the blood pressure goes up, that she doesn't start to re-bleed. We're not going to leave this on for hours and hours. We're going to rush this patient to definitive care at a trauma center, and we'll get control over that bleeding, get rid of the tourniquet, and then restore perfusion to the hand. But right now, there's no blood flow getting in down here because we have this tightened up. So the rule that we use for taking the tourniquet down is at the definitive care site. Don't take it down beforehand. We use tourniquets every day in operating rooms for orthopedic procedures for hours at a time. Our military experience and now our civilian experience would demonstrate to us that several hours of use of a tourniquet to control hemorrhage does not result in significant complications. And our experience with that is we've now got more than 100 patients treated by Gold Cross and Mayo One with the use of extremity tourniquets. And they carry with them a greater than 95% success rate in stopping bleeding.
Okay. Okay, so we're going to show you next how to properly use a tourniquet. This device I have right here is a combat application tourniquet. They come in many colors. You can get them in blue, black, orange. I believe the doctor on the video also had an orange one. They use these a lot for civilians, bystanders, and the new Stop the Bleed campaign also utilizes these orange combat application tourniquets. I think they are called combat application tourniquets because they were first demonstrated, as the doctor defined in the video, in the military setting, and the name just transferred over. So this is the tourniquet that we're going to use today. And to first properly use a tourniquet, you need to wrap the tourniquet around the bleeding limb. You want to place it 2 to 3 inches above the bleeding site, and don't put it necessarily on the joint. Go above if you need to. So I'll take the arm, on Velcro, 2 inches above the injury. Gonna make it as tight as I can with the Velcro strap. And secure it around. We're gonna pull it tightly. The band should be tight enough that you cannot put 3 fingertips through the band. Surround the entire Velcro strap with the other piece of Velcro, but do not put it over the windlass. Keep that open because you need to be able to access that. Next, you take the windlass and you tighten the tourniquet until the bleeding has stopped. You no longer want to feel a pulse distally to where the tourniquet is applied. Also, if you're still having bleeding and you've tightened the tourniquet as far as you can, you are able to put a second tourniquet on top of this. So you want to take the second tourniquet, put it along the same extremity, and put it farther above this tourniquet. Next, once the bleeding is controlled with 1 or 2, you want to snap the windlass into the securement device. And then there's this extra white strap, sometimes it's gray. You want to put that on top of the windlass securement device, and you can see that it says time right here. You want to indicate the time that you put the tourniquet on. This will be very beneficial to the ER doctors and the trauma surgeons. Okay, next we're going to take a few minutes for demonstration and practice. So we'll take this one off and we'll let a volunteer come up. Okay, the next thing that's very important in tourniquet use, there can be a lot of mistakes that are made. Some of them include not making the tourniquet too tight. Some people think that once the pulsatile bleeding has stopped, that it's okay, that even a little trickle is fine. No, you want to make sure that it's tight enough so that you no longer feel a pulse and that the bleeding has completely stopped. Another mistake that happens sometimes is that people will feel pain. If this guy is awake and talking to you, he'll say, ouch, that hurts, that hurts. He'll be screaming, he'll be writhing. But Tourniquets do hurt. In this circumstance, it's limb versus life. If you want to save his life, you have to put the tourniquet on to stop the bleeding. Even though it does hurt, that does not mean take it off. I want to stress that, it's very important. Sometimes another mistake people make is waiting too long to put the tourniquet on. After you see and you identify the life-threatening bleeding, you want to put the tourniquet on as soon as possible. Trust your instincts, you know what's best. Put the tourniquet on and you can possibly save their life. Tourniquets should only be removed by a physician. This should only be done when you get to your final destination as far as the emergency room. Let them handle all of that. All right, I have another video here.
It was a little strange to sit down to someone that you've never met before and decide that you're going to grab their hand and tell them everything is okay.
I screamed. That's all I remember doing at that moment. I knew I was going to wreck.
I remember feeling like we had to do something immediately right now.
The day started out like any other day. Wasn't cold, wasn't hot. My friend called me that morning and he said, I'm going to take out my Harley and you got your new bike. And so let's just go out and have some fun.
All of a sudden, I see the woman on the motorcycle just flying through the air. I just remember saying, stop the car.
I remember getting thrown head first over the motorcycle. And I heard them say, don't move, please don't move. Blood was streaming down and it went on into the gutter. There's still the mark of blood.
And then when we pulled up and saw her, blood was rushing down out of her leg and into the gutter. My husband's cousin took his shirt off and immediately started applying pressure to stop the bleeding.
Camille was holding my hand. I remember that distinctly. She was saying, you're going to be okay. And to hear those words were so important.
I really feel bystanders have a responsibility to act. Don't be afraid. You're not going to hurt yourself. You're not going to hurt the patient. All you'll do is help, even if it's just a comforting hand.
Doing something is better than doing nothing. That helps us more than they would ever realize. That can make all the difference between life and death.
If you imagine yourself in a situation where you've been in an accident, you're vulnerable, you're frightened, think about what you would want.
Okay, so next we're going to do a little case study. I want some participation from the crowd. The case study says that while on duty, a police officer responds to the report of a drug deal. The police officer questions the suspect on his actions, and the subject becomes aggressive. The situation quickly turns into an altercation, with the suspect pulling out a gun from his waistband and shooting a police officer in the right leg above the knee. The police officer notices a steady stream of blood pouring from the wound and that his uniform quickly becomes saturated in blood. The police officer retrieves his newly issued tourniquet but is not sure how to use it. He places the tourniquet around his right leg, 2 inches above the wound. He tightens the windlass and secures the device. He notices that the bleeding has slowed but has not stopped. He is feeling significant pain since the placement of the tourniquet and thinks he must have applied it wrong. By this time, the ground around the officer is saturated with blood and emergency crews arrive. So I want to know, did he use the tourniquet appropriately in this situation? So it looked like his blood was completely saturating his clothes. He saw the blood pouring out, so he appropriately used the tourniquet. Did he put it on correctly? Yes, he did put it on correctly. He put it on the area of the injury. He put it 2 inches above the wound. It looks like he tightened the windlass and secured the device appropriately as well. I think his fatal mistake was that he noticed that the bleeding had slowed but had not stopped. He should have tightened it until the blood completely stopped. Another mistake that he made was that he felt the significant pain and thought that he must have applied it wrong. Like I mentioned before in the video, that pain is a normal response for the application of the tourniquet. It sounds like he did everything correctly. He just needed to tighten the tourniquet a little bit more. But luckily the emergency crews arrived. And finally, I'm going to leave you with this slide. The only thing more tragic than death from bleeding is the death that could have been prevented. Does anybody have any questions?